Good day. Welcome to Conversations with AARP in the Virgin Islands. I'm Troy Deshabir-Schuster, State Director of AARP in this territory. And as always, it's a great pleasure to be with you, and especially during this holiday week. So as we continue our journey through the week toward the weekend, I wish every one of you a very happy Easter. And we hope you have very pleasant gatherings with your family. Please remember social distancing. Remember to use your masks. Remember to wash your hands regularly. We want everybody to be safe and healthy and remain COVID free. Today, we have some special guests with us from the Preventing Healthcare Fraud, Waste, and Abuse in the Virgin Islands. And these are members of the Virgin Islands Healthcare Fraud Task Force. And so we have with us Ms. Amy Griles, who's the project director and senior Medicare of the Senior Medicare Patrol Program. And we also have with us Gary Smith, the director of Medicaid program for the Department of Human Services. Welcome, Amy and Gary.
Thank you.
Thank you, Troy.
Thank you. It's a great pleasure to have you with us today as we talk about this very important topic, which all of our older population needs to be very aware of. And so in 2019, the Center for Medicare and Medicaid Services, also known as CMS, reported that fraud, waste, and abuse in the healthcare system of the United States accounted for 3% of our total healthcare spending, costing Americans more than 60 billion, that's with a B, every year. AARP is working to empower consumers, especially older Americans, to spot and avoid those who seek to prey on the vulnerable population and to provide support and guidance to victims and their families when fraud happens. And so we thank both of you for this very important work that you're doing to help to at least mitigate the healthcare fraud. And so, Gary, starting with you, tell us, what do you do precisely within this department, within the Department of Human Services?
So again, Troy, thanks for having me today. I'm the Medicaid director for the Virgin Islands Medicaid program. We provide benefits and access to health care for approximately 33,000 citizens in the U.S. Virgin Islands, and approximately of that 33,000, about 3% is of the age category, or would be clients that the AARP serve. And we work in conjunction regarding fraud, waste, and abuse with the Medicaid Fraud Control Unit, which operates out of the Virgin Islands Department of Justice.
Okay, so the Virgin Islands Department of Justice then works hand in hand with the Department of Human Services. Am I correct with regard to this matter?
Yes, sir. Yeah, regarding fraud, waste, and abuse. Yes.
Okay, so if there's a report of fraud, waste, and abuse, then I'm assuming then the Department of Justice will conduct an investigation and take any action necessary?
Yes, sir. It's a great collaboration which began in January of 2019. We have regular meetings, and they have access to the different systems that we utilize to enroll our members, also to pay claims. So yes, it's something that we look very much forward to in moving our Medicaid program forward, and being able to be proud of the program like our sisters and brothers on the mainland in the United States.
Excellent. Very important work. Thank you. And Amy Griles, tell us about your role within legal services of the Virgin Islands. If you will, first just give us a high-level overview of what legal services of the Virgin Islands does, what they provide here in this territory, and then getting specifically into what you do within that agency.
Okay, so Legal Services of the Virgin Islands is the only legal aid entity in the territory. We provide access to justice to low-income individuals and individuals who would actually not be able to afford a lawyer or legal counsel. We specialize in evictions, medical fraud, uh, wills and deeds, and powers of attorneys, and as well as divorce cases and cases of domestic violence.
Okay, very important work, and especially for those people who are very vulnerable. I mean, not be able to afford private legal counsel.
Yes. Yeah.
And go ahead.
I was going to say, the main goal of legal services is really to provide access to justice for all individuals in the territory who are able to receive our services.
Okay, thank you for that clarification. And now, what do you do within Legal Services of the Virgin Islands?
So I have dual roles here at Legal Services. My main role is I serve as the project director for the SMP program. SMP is for Senior Medicare Patrol, and the SMP program empowers and assists Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. Our programs are grant funded from the federal government, from the U.S. Department of Health and Human Services, which is HHS, and the U.S. Administration for Community Living, which is the ACL. We work in three main areas. We do a lot of outreach and education to the local community. We recruit and train volunteers to engage with the local community, and we receive beneficiary complaints. And when I say receive beneficiary complaints, we basically serve as the liaison between a Medicare beneficiary and their provider if they suspect that they have been the victim of fraud, or if they're not certain. And the issue we have a lot of times here in the territory is with our older community is they don't like to report what they think could possibly be fraud because they don't like to tattle on people. It's part of the culture, so they are very hesitant. So that's where we come in, so they don't feel afraid to advocate for themselves. So we advocate for them.
Okay. And so the Virgin Islands Healthcare Fraud Task Force, either one of you, if you can share with us what is that task force about? Where does it reside? Is that task force within the Department of Human Services or Legal Services of the Virgin Islands?
I can answer that, Troy. So the Virgin Islands Department of Justice and the United States Attorney's Office partnered last year to create the task force. It is a territory-wide task force. In addition, the task force comprises the Federal Bureau of Investigation, which is the FBI, the Disability Rights Center of the Virgin Islands, my program, which is the Virgin Islands Senior Medicare Patrol Program, Department of Human Services Medicaid Program, and the Center for Medicare and Medicaid Services, which is CMS, and they're based in Puerto Rico, but they serve Puerto Rico and the U.S. Virgin Islands, and the U.S. Department of Health and Human Services Office of Inspector General, which is HHS-OIG.
Wow, that's a
lot.
Task force.
Yes.
Quite significant. And do you have regular meetings of this task
We
force?
meet quarterly. So our next meeting is coming up in a few, right after the Easter holiday.
Yep.
I see. Okay. And so if there is an older person then who feels like they've been a victim of Medicare fraud, where do they start reporting it? Who do they go to first? Is it Department of Human Services and the Older Adult Protection Services, or is it to Legal Services of the Virgin Islands, to the task force? How do people file a report?
Well, there's different ways, and they can come to the whole point of the task force is elderly beneficiaries can come into any one of those offices and speak to someone, because we know we're all in contact with each other, because we like to work smart, not hard. We're all here to serve the community and do the same thing. So if someone calls Gary's office, he knows because he does Medicaid, I do Medicare reporting. So if someone calls his office with a Medicare question, he can forward them to me, and I can do a client interaction and then report it to the the right source, which would be OIG and CMS, and vice versa. If someone calls me with a Medicaid questions, because I get a lot of Medicaid questions because people confuse SMP and MAP. So very often, so if someone calls me, which happens a lot, about MAP, I'm able to, get them to Gary's office as well.
Great.
And
And so,
so,
Gary, you tell us now from your perspective.
yeah, so I'd like to add, and thanks for that, Amy. So for the Medicaid program, as I mentioned earlier, we're working in collaboration with the Department of Justice and the Medicaid Fraud Control Unit, or the MAFUCU, and there is a hotline that folks can call, and that number is 888-404-6328 in the event that they think that there's some type of fraud going on with a visit to the their provider, or some type of something that doesn't seem right to them. A lot of fraud in Medicaid happens with claims billing. And that's an area where I know the MAFUCU is really focusing on. As I mentioned, they do have access to our claims billing processing system, which they can review and track, different trends. And, we've also provided training with the vendor and manager of that system, which trains in identifying irregularities in claims billing, so forth and so on.
Okay, so just to recap and be clear, if somebody has a Medicaid issue, then they can either contact you, Gary, or better yet, to contact the MAFUCU hotline, right?
Yes.
And again, that number is 888-404-6328.
Yes, and also there is a unit within the Department of Human Services that elderly abuse can be reported to as well, which there is some fraud that goes on, in that space. And I will make sure to get Troy you that number and your organization so you can share with your constituents. But there is also an avenue there for them to report fraud. But the department's contact number here at Human Services is 774-0930, and they can ask for the intake unit and file their report. But I will make sure to get that specific number for you, which there is a hotline number for that as well.
Great, thank you. And we'll publicize that. And then if somebody has an issue with Medicare fraud, then tell us exactly, Amy, who do they contact?
They can contact the Virgin Islands SMP, and our number is 1-877-784-0228.
Okay, and so again, if it's Medicare fraud, then they report that to your SMP program within the department, within
legal services
of the Virgin Islands. Sometimes this is so confusing, and that's why we do these shows, because there's so many agencies that do such great work, right?
Mm-hmm.
But it's our goal to help to unravel it and make it clear for the older population, and also a learning experience for me too.
And let me also say, with our I mentioned to you before that a lot of times older retirees and beneficiaries, I don't like to say older people, they're very hesitant to report fraud because they've been with Dr. Smith's office for 30 years. They don't want to tell on Dr. Smith, because they think something might be wrong, but they don't want to be that person. So usually what the calls I get in regards to Medicare fraud, potential Medicare fraud, are from the family members and the caregivers. It's usually the sandwich generation or the millennials in those families who are like calling me, emailing me, or texting me because they're like, no, my grandmother get a statement, and so they're very ready to advocate for their family members. So our number, as like I said, is a toll-free number. You can call. A lot of times we get text and fax from that number as well, and those usually come from younger family members and caregivers of those beneficiaries.
Okay, so first of all, can you repeat that number again? And then also, you said texts and faxes. So,
Faxes at the same number.
oh, really? You could send everything. You can make a
Yes.
voice call, text, send a fax,
Yes.
everything.
Yeah.
And what is that number again?
It's 1-877-784-0228.
Excellent, excellent. And Gary, I saw that you were about to say something a moment ago, and we interrupted you.
No, that's fine. That's fine. I just wanted to add that, Troy, being a part of the task force and meeting Amy, we have pledged to collaborate more and work together because, as she mentioned, she receives a lot of Medicaid calls, so she can be a great help to us and our program, in what we do, and also to protect our members as well as protecting her members. And I'll also like to add the task force is an opportunity for the Virgin Islands, the different agencies that are involved to have that collaboration to ensure that our citizens as well as our elderly citizens, are educated and are made aware of these things. So, for instance, a Medicare beneficiary who also has Medicaid should not receive a balanced bill from a provider. Once Medicare pays as the primary, and then Medicaid pays as the secondary, federal law states that they should not be billed for that balance. Also, Medicaid beneficiaries, our state plan does not include any coinsurance or any deductibles. Therefore, our members should not be paying any type of funds, cash, upfront to a provider who is a Medicaid enrolled provider for any types of services. Once they are a Medicaid enrolled provider, they should not be billing or requesting any upfront payments for our members. So, thank you for providing this opportunity so we could get that type of information out. And as I said, it's a great opportunity for the task force to make sure that our Virgin Islands citizens, are made aware of these things, because I can tell you a lot of them are not. And I want to thank you for this opportunity.
Thank you for sharing all of this information with us, both of you. And now here's a bit of a hot button topic, and I may be stepping into some deep waters, but when it comes to pharmacy services, now, as both of you are probably aware, I'm the founder of the Medicine Shop Pharmacy in Sunny Isle. I owned it, operated it for over 9 years, close to 10 years. And when we would process prescriptions for Medicaid beneficiaries, we would have to adjudicate it through Cigna. That's the payer for Medicaid when it comes to pharmacy services. And sometimes we would get a feedback from Cigna and as to how much they would pay, and it would indicate that we're actually losing money. What Cigna is reimbursing is below the wholesale cost of the drug, right? And what some pharmacies here in the Virgin Islands do is they will then ask the patient to pay that money. So let's say if they see they're losing $10 on the prescription, they would ask the patient to pay that $10 out of pocket. And that shouldn't happen. That should not happen. The pharmacy should fill the prescription, and if they feel that they're not in the position to fill the prescription financially because they're losing money, they should then, help the patient to transfer it to another pharmacy. But the patient needs to receive the medication, and they should not be billed. So I'm right here making an appeal to you on behalf of your Medicaid beneficiaries to really monitor the pharmacies in the Virgin Islands to make sure that they're not trying to collect a copay that they themselves have developed or imposed, right? Because this happens a lot all over the territory. and it really should not happen. Have you heard these reports from your Medicaid beneficiaries?
Troy, thank you for bringing that up, and that is an area that continues to be a work in progress. And you are absolutely correct. Cigna is the pharmacy benefit manager (PBM) for the Medicaid program. That issue should be an issue between the pharmacy and the pharmacy benefit manager when they negotiate their contract and what rates are going to be paid for the medications. I think one of the ways that we will address that issue is developing our own preferred drug list and also work with the pharmacies to do that. But yes, you are absolutely correct, and that's why I made my earlier statement about Medicaid members not should not be paying, making any co-payments for any services, medications, labs, X-rays, doctors' visits. And I would say that if anyone listening to the program who's a Medicaid beneficiary should take down the number 888-404-6328 and file that complaint and with the Medicaid Fraud Control Unit, because the providers should not be looking to receive any type of cash payments from the Medicaid members.
Excellent. Thank you for that clarification, because again, people aren't aware and they pull out their wallet, put their hand in their pocketbook, as the case may be, and they just pay because they need their medication, and then they're being defrauded all along the way.
Exactly. They need the medication, so they just go ahead and make that payment. And the population that we serve, the underserved and also our most at risk, the majority of the times, or all the times, they just can't afford to be coming out of their pocket to make those types of payments. So I'm urging the listening audience, if you're a Medicaid member and this is happening to you, please do report it to the hotline number at the Medicaid Fraud Control Unit.
And without violating any mandates of confidentiality, what kind of fraudulent acts have you all been seeing here in the Virgin Islands? Can you give some examples, just on a very high level, of what kind of Medicare or Medicare fraud you may have encountered here in the state?
I can answer that. What we're seeing nationally, and it's trickling down, because usually, as a smaller territory, we're the last to receive, to get to know about these scams. But one of the ones that sticks out is that a lot of Medicare beneficiaries are receiving calls from someone claiming to be from the Department of Health after they've received their first vaccination. And the person is calling to say, you know what, we know you received your first vaccination, Mr. Smith. What's happening is that your second vaccination was supposed to be on April 8th, but it has to be rescheduled. So we're calling to verify your Medicare number. So they're trying to get the person's Medicare information, and then they're using it fraudulently. You shouldn't be receiving any calls like that, because you yourself know where you made your which provider you made your appointment with to receive your vaccinations. But like I said, with it's really a cultural thing. The older population, they have a deep level of respect for authority, for medical authority, for law enforcement. So if someone calls from the Department of Health, they just assume it's a legit call, and they're ready and willing to give their information. But what we try to tell beneficiaries and their caregivers is, like, only share your personal information in addition to your Medicare number, your social security number, your credit card information. You only share that with trusted professionals. And if you're suspicious, because a lot of times we don't trust our gut, and if you're suspicious, it's totally okay for you to be like, you know what, I know you say you're from Department of Health. Can I have your number? I'll call you back. I need to double check with my doctor or something like to that nature. So that's one of the most prevalent ones we're seeing. And also the second one, and they're both related to like the vaccine, is a suspicious email is going around to Medicare beneficiaries asking them to complete a COVID-19 survey. And in turn for completing the survey, if they give their credit card information, they can receive a free reward for a nominal shipping fee. So they're doing a survey, they're sharing their personal information, and they're sharing their Medicare number and or credit card information for that nominal shipping fee. And that's not true. And usually the things with these surveys, the emails, is like you have to do it within X amount, like by April 4th. The things with surveys, a legitimate survey has no time limit, and they wouldn't ask for any banking or credit card information as well.
Right. I always tell everybody who would listen to me, and especially the population, especially my own mother, right? Because she's gotten all kinds of crazy calls. I've gotten unusual emails. Number one, IRS, Social Security, Medicare, Medicaid, none of these agencies will call you on the phone, and they're not going to send you an email. They're going to send you a letter in the mail through the United States Postal Service, delivered to your P.O. box or to your home, whichever delivery address you have on file with them. And that's how they will communicate with you. And they may have a callback number for you to call them, but they will never, ever, call you.
Exactly.
And so I always tell my mother, if somebody like that calls you, hang up the phone or tell them, oh, wait, what's your number? I'll have my son call you back. And usually by the time she says that, they hang up, right? Because they don't want to give the number, and they certainly don't want the son calling them.
Exactly.
So again, we pass it on to everybody, no matter how old or how young you are. Don't answer all of these questions over the phone. These governmental agencies are not going to call you up like that. They're going to send you an official letter, and sometimes even certified mail.
Yep.
So be very much aware of that. We're running really low on time now. We have just about a minute and a half. So any parting words for our listening audience?
So just to let the public know that the Medicaid program is in the process of standing up a program integrity unit, which will be working very closely with the Medicaid fraud control unit. It's a work in progress. We're working on obtaining the necessary funding to be able to bring on staff, and that's we're looking very forward to that because it's much needed right now with the Medicaid program, with our exponential growth over the past 5 years, and we will continue to keep your listening audience, Troy, and your organization up to date on our progress and any updates that you would need to know to share with your constituents.
Fantastic. Thank you. And Amy, you have 30 seconds.
I just want to tell everyone, if something does not feel right, it is within your right to not trust it and to call us. We can advocate for you or find out more information for you. When in doubt, just report it. And just remember that Legal Services and the Virgin Islands Healthcare Fraud Task Force are here to support you and to make sure you're receiving quality services in the territory.
Excellent. Thank you both for all the great work you do protecting our vulnerable population, our older population, and I wish you much continued success in your work. Thank you so much.
Thank you for having us, Troy.
Thank you for having us, Troy.
A pleasure. Have a great day. Happy holidays.
Same to you.
Thank you.